following segment is sponsored by Munson Healthcare.
February is Heart Health Month, a good time to consider how well we know our hearts and how to keep them healthy. In this month's Your Health Matters, we're getting to the heart of the matter, knowing the signs that could reveal heart disease and ways to keep our hearts beating strong. Dr. Howe, thank you so much for joining me.
Yeah, thank you.
So what are some risk factors for heart disease?
What we call modifiable risk factors are things that we think of like high blood pressure, high cholesterol, smoking, obesity, unhealthy diet, lack of exercise, and diabetes.
So you are calling them modifiable, which means you can prevent them. What are
Right.
some good things that people can do to help prevent the development or continuation of heart disease?
Sure. Well, to be clear, there is a genetic component to heart disease. That's something you can't change about yourself, and it's important to be aware of your family history and talk to your provider about that so that they're aware as well. In terms of the diseases I mentioned that we can control, to make sure your blood pressure is under good control, to make sure your cholesterol is well controlled, to work hard yourself to eat a healthy diet, a well-rounded diet, making sure you're finding time for exercise, not smoking. We have a lot of good therapies for cardiovascular disease, but it's actually more effective to prevent it from developing in the first place.
What are the signs and symptoms of having a heart attack, and do those differ between men and women?
They do, and so the differences are important. Everybody thinks about heart attacks as being a heavy, crushing pain in your chest, and that certainly can be true for both men and women. So tightness, pain in your chest that may radiate to your arm, to your shoulder, up to your jaw, dizzy, abrupt onset shortness of breath, those are all really concerning and more prevalent in men. That's more of a typical presentation in a man. The symptoms in women can be much more vague. It could just be extreme fatigue, new nausea, tingling sensations in the chest. So really listening to your body, listening to symptoms that may be an abrupt change.
Is there anything else you wish people knew about their heart health?
Well, it is winter in northern Michigan, which is a different set of exposures for your body and for your heart. One of the things that we do worry about is people that may have been more sedentary, engaging suddenly in strenuous physical activities, such as going out and shoveling that heavy, wet snow or climbing that sledding hill with your children. So we really want people to sort of take caution in those settings. Make sure you dress warmly, dress in layers. We want you to be warm but not overheat. We recommend tackling that physical activity sort of in smaller, more manageable segments. It's important to cover your mouth and your nose with a scarf or a mask. That helps decrease the amount of cold air you breathe in, which would naturally cause some narrowing of the arteries in your body. So just really listen to your body. If you start to feel dizzy or lightheaded, like you can't do it, make sure you stop. And if there's anything concerning symptom-wise going on, make sure you seek emergency medical care.
Getting to know your heart is a great first step. We encourage you to take the Munson Healthcare Heart Health Assessment. Visit the Your Health Matters page on upnorthlive.com to get started.